More than 1.5 million Americans receive hospice care each year. Many people have questions about how it differs from traditional medical treatment. Well, let's welcome Holly Nye, Community Liaison for Crescent Hospice, here to break down its role in medical care. Glad to have you with us.
Thank you for having me.
Maybe you can illustrate for us what hospice care does, who it's geared for, and typically at what point does one choose to take on hospice care?
So hospice and the hospice benefit comes into play when a patient has a qualifying terminal diagnosis, which could be a whole host of different diagnoses. Some are very black and white depending upon the situation. Some we have to paint a picture to understand why they qualify, but it's when they have that terminal diagnosis and they've decided to not further aggressively treat that diagnosis. So an example would be if a patient has cancer and they have elected to no longer go to chemotherapy, radiation. You know, it's when someone has decided that they're tired of going back and forth to the hospital and the specialist and the treatments, and they just want to embrace quality of life and comfort care, be with their family, do whatever it is that they want to do, however they want to do it, of course, within the realms of, I mean, what they're capable of.
Sure,
but, you know, it's when they decided that this, you know, the writing's on the wall.
Right. And so the prognosis is not lengthy.
Yes.
And so they know that there is going to be an end date, essentially.
Right. And, you know, we have younger patients, too, and let's say they've been through 3 rounds of chemo, and they just say, you know, if this is how it is, I want to go on vacation. I want to be with my family. You know, I, very personally had an aunt that was on hospice, and she wanted to lay in bed with her cat and her granddaughter. And so that is what she did.
And I wanted to ask you, so you say, you know, for young people who want to go on vacation, but they're still under hospice care technically. So a hospice situation doesn't necessarily mean that you're bedridden.
Right.
So you can be under the care of hospice specialists, but still do all the things until you no longer can.
Yes, we do not require patients to be homebound. We do not give any parameters whatsoever, other than, of course, embracing the hospice philosophy. And we like to know that you're not going to be home when we're going to come visit. You know, that way our nurse or our aide don't come, and we can schedule for a different time. But we want people to go and do.
Right. And let's talk about the hospice nurses and aides. They're a special sort, aren't they? I know that they bring a lot of comfort in times which can be very poignant and distressing. So what do you look for in a hospice nurse or aide? You know, what is sort of the profile that one can expect?
So working in hospice, in any of our disciplines, working in hospice, of course, we need jobs, but you don't do hospice to have a job.
No.
You do hospice because you have a passion for it. And it comes in many different forms. Our clinical nurses, they have a passion for helping the dying, for keeping people comfortable. Someone like me in a community liaison role, I'm an advocate. I am a social worker by trade, and I advocate for people, all people, anytime, for whatever it is that they need, and to make sure they have the information and they're getting what they need, and they know they have choices, and they know they can say, I don't want to do this. I do want to do this. This is what I choose. It's very empowering to give that to someone. And in this kind of situation, it's one of the last things we can give them, and the most dignifying thing that we can give them. So our nurses, our aides, our program directors, our clinical directors, our marketers, our social workers, our chaplains, everyone, we have that passion for making sure people are living and not dying. Every situation is different, and every situation will touch you in a different way. You may relate to this, somebody's husband, somebody's mother.
Sure. I
love the fact that with my job, I learn something new every day. I take something new away every single day. And there are days though when I go home and it's just, oh, that was a hard one.
I'll bet, yeah.
But the silver lining is they got what they needed. And this is going to happen whether we are there or not. So if we are there, they chose, their family chose, and we're following that journey with them. And that, no matter how difficult the situation, that makes it just much better for the heart.
Finally, just curious, what other services or benefits, when someone does elect to engage in hospice care, can they typically expect?
So with our team, whom I mentioned, we have our medical directors that oversee all of the care that our nurses give. They are registered nurses. We have social workers, chaplains, certified nursing assistants, volunteers, of course, the advocates, the marketers. We provide any equipment they need, incontinency supplies, comfort meds, all meds pertinent to diagnosis. We will come to wherever they call home. That could be within a facility, that can be in a typical home setting. The benefits covered 100%. And we also have a bereavement social worker that will talk with the family and stick with that family for up to 13 months after.
Really?
And of course, if they need longer, but everyone grieves differently.
Indeed.
So, head down, keep moving, and then you wake up 11 months later and say, I never dealt with this, and we're going to be there for them.
That's wonderful. For anybody who wants more information on Crescent Hospice, where should they go?
Well, you can always give me a call.
Okay.
My number can be attached to this segment,
Certainly,
I assume.
we'll put it on the screen.
And then our website is www.hospicesc.com.
Wonderful. Thank you so much for sharing with us.
You're very
Appreciate the
welcome.
work that you do.
Thank you for having me.
Calling for sure. We'll be back in 2 minutes.